Hey guys, my name is Mavi and I've spent the last 14 years in the plastic surgery and beauty industry, working alongside top board certified plastic surgeons. In that time, I've helped thousands of women in their surgical journey. My passion to educate and help women feel empowered is what led to what we now know as the Big Butts, No Lies podcast. Join in on the fun as I talk to plastic surgery experts, friends, and real-life patients about all things plastic surgery. Should be fun. Okay, so let's answer these questions. The first one is foams and boards. When do you use them? When can you stop? And should they be all day?
All right. So I'm going to start by summarizing the answers to all three, and then we can dive deeper into it. So when do you start using them? The first month after surgery is definitely the best time to use them. I would for sure push for 4 weeks of using the foams or until you're able to get a faja that properly fits you without needing any foams, which actually takes me to how long should you wear it for? You can absolutely get rid of them after 4 weeks. Obviously, listen to your surgeon on that one, but you can definitely get rid of them after the 4 weeks because A, your skin is going to be a lot more alert to if anything were to be wrong, and B, the fragility of your skin caused by the aggressive liposuction is now significantly more, strengthened and recovered. Yes, it's only 4 weeks and you're nowhere near being done recovering, but your skin is definitely able to handle stronger compression. So you can absolutely get rid of the foams once you have a faja that properly fits you.
That's the perfect answer. Yes. As soon as you have a faja that properly fits you. So the foams help with compression, and that foams in the clinical setting were used when the faja started to fit too loose on the middle, but we didn't want it to go smaller on the thighs for the BBLs. So we would load them up with foam. And that's really the main, besides helping the swelling go down, it helps you keep the compression on your hips not so tight, but tighter on your waist. So that's why when you get your garment altered, you don't really need them at all.
Exactly. And that alteration is literally magical. Like if you can get the alteration between week 3 is the earliest, the absolute earliest. Between week 3 and week 5, you're going to literally see magic happen overnight because your waist will respond to that compression so beautifully and so quickly. It's very exciting to see your waist go down that quickly.
It really is. It really is. And you guys, you look in the mirror and you're like, is that me?
Like, oh my God, is that me?
Is that me?
Okay, girl?
Yes, girl, that's you. Okay, let's answer this question. Do fajas just help with swelling or do they shape you too? And actually, hold on. That question is repeated 1, 2, 3, 4, 5 times. And it's in a different variation of it. Does faja really shape your body or is it a myth? Is the second question. So does faja just help with swelling or does it shape you too? That's another question. So it's the same question.
Right.
We talked about it a little bit. Tell us what you think.
Anyone who tells you that the faja is going to mold you, just bad advice right there. It's not true. The faja is definitely it supports everything that the surgeon put in the operating room. And that's the part that's really the most important thing because you can't have, wrong, false expectations of how you're going to look. There's a limit to certain things just based on your anatomy, based on how much fat could be safely removed from your body, etc. So you can't expect to be like, oh, okay, I'm going to lose 10 inches off my waist. The faja will definitely help you to an extent. And the extent is the one that however much your surgeon was able to take out of your body and however your personal anatomy is just genetically. So does it mold it? No. Does it get you to the shape that your surgeon gave you? 100%.
Absolutely. That's how it works.
Just like that.
That's what it works. It's not. So, okay. Your faja is not going to give you a shape when you're not wearing it.
When you're not wearing
it. That shape was already given to you by God or your surgeon. So your faja helps compress swelling and it helps your skin adhere back to your fascia. So what it's doing is just helping everything heal a little bit faster. Okay, now, for example, think about a C-section. They're doing a C-section and they're just cutting through. They're not even lifting, they're not even lifting the skin the way they lift it during a tummy tuck. And women who have C-sections should be in garments too. Fájate. After a C-section, fájate, because that skin needs to adhere. And I cannot tell y'all how many women I've seen in front of me with C-section scars with skin that hangs over it, or it's just loose. Mm-hmm. And it could have been, a little faja could have helped.
It could have been prevented. Yeah. It's essentially like, envision the faja is like a guiding, helping hand that is pushing back the skin and holding it where it needs to be ideally. So every time you take it off, or if you're team no faja, which I strongly disagree with.
I can't believe there is a team no faja.
Girl, it's a whole thing. It's a whole movement.
But why?
Hey, I don't know. I think it may be, having bad experience with faja, or it being such a big, mysterious black hole of information that people get overwhelmed and just give up before even trying.
I can see that. And that's why it's so important for people like you and I who are in the know, and people who have gone through the experience and who have lived it, to help other women who are thinking about it, but don't even know where to start. Because the internet, when you find something on the internet, you can find the opposite argument, just how you can find the same.
Every time. Absolutely. For real.
I mean, there's people who believe the world is flat.
Yep.
Really. There really is people who believe the world is flat. So I'm like, oh, okay, there's a team no faja. Okay. You guys.
It's a whole hashtag.
What? Yeah, let me look this up.
Girl, it's a whole hashtag. Now, I haven't really kept up with anyone who's team no faja, but, and here's the thing. Are they really going to know a difference? Because there is no direct comparison on their own body, because
exactly
it's either one way or the other. You can't have both. Like with arnica, you could, theoretically smear it on half your body and observe the difference, right?
Correct.
Because with a faja, there's either on or off. But I really strongly recommend on. And if you find the right ones, you're actually going to like wearing them.
I feel good. I do feel good in my faja. You're right.
I totally love wearing them. And like I mentioned earlier, I still wear them now on 1 year post-op to look extra disrespectful. And that goes back to the molding part. I'm molded like a goddess when I have it on. Okay. Because, some of those fajas, the ones that I really like, have a little bit of booty lift. So it will just make you look so good. But as long as you understand that is just while you're wearing that garment. If you want that look to be without outside of a garment, you may need to consider another round or something else, maybe dim, who knows, whatever it might be that works for you. But the faja is not going to mold you. It's just while you're wearing it, you're going to look fabulous in it if you have the right one, and feel super confident and feel sexy while it is giving you that medical purpose that it really is designed to serve, which is, compressing you and guiding your skin back to readhere.
That's right. Okay, let's answer this question. I'm 7 weeks out. Is it too late to start wearing a faja?
I get these questions quite often. It's not too late. It's not too late. Better start now than not at all.
So
definitely.
Yes, it's not too late. And let me tell y'all something. So I had a phone call last week with a very good friend of mine who is a lymphatic massage therapist. And we were talking about the massages, and I want her to come on because she's so good, but she only speaks Spanish. She's actually Memorial Plastic Surgery. She's the person that they send their patients to, Dr. Shu. Mm-hmm. And she's amazing at what she does. She's Colombian. And she was telling me about, women who come in to see her for lymphatic drainage massage. And the way she was telling me is, look, Mavi, when the liposuction is done, and I know this is true, when the liposuction is done, the cannula leaves a space. Imagine like a road a canal, a river, whatever you want to imagine it. It's leaving a space. And there's fluid in that space, the tumescent fluid. She said the massage, if you start immediately, like, a couple days after surgery, she said those channels are still open for me to maneuver the fluid through those rivers, through those canals, out to the opening that's in the skin where I can push the liquid out. She's like, if a girl comes to me and she's at 7 days post-op, she said those channels are pretty much closed. She's like, or they're closing. She said the amount of fluid I can get through those channels is less and less and less every day that I see. She said every day that goes by, the more healed they are, the less fluid I can get out, if any at all. She said, and that fluid stays in there or is absorbed by the body. So let me tell y'all, before massages and fajas, let's say 10 years ago, the patients just had liposuction and the tumescent fluid just got absorbed and went through their system and was eliminated before. That's how it was done. In Colombia, they don't wait for the fluid to be absorbed by your body. They push it out. That's what those lymphatic massages are. So for massages, because massages and faja are kind of coming hand in hand now, right?
Yeah.
For massages, it is too late at 7 weeks. For faja, it's not.
I agree with that all the way. I started my massages at day 2 post-op. And yes, it's a whole struggle. It's not like a deep tissue massage or,
it's not one of those pleasant massages.
No, it's not one of those. However, if you can push through it, take an ibuprofen before the massage or a Tylenol, push through it, it will make you feel so much better afterwards.
And it shouldn't be painful. What you should be feeling is more like a tenderness or like a soreness. And really it goes back to your pain tolerance, how much pain you can tolerate. But it should never be excruciating pain. It shouldn't be. I hope y'all aren't experiencing that out there because it shouldn't be. And just how our girl here, the Faja Doctor, has had to deal with botched fajas. There's massage therapists out there having to deal with botched massages.
Oof.
How can you botch a massage? Let me tell you how you can botch a massage. You can tell somebody that you're doing a lymphatic drainage massage and that you know what you're doing, but you don't. You're not doing a lymphatic drainage massage. You're just doing a soft, Swedish massage, and you think that they're not going to know any better. Your faja and your massages are going hand in hand. So massages, you need to start them within that first week. And you guys, planning is crucial. You have to plan. You have no other option. So when you plan your surgery, massages, your faja, all of these things need to be already in place before you go under. You don't want to be dealing with who's altering your faja, trying to figure it out, when you're 2 weeks.
Swollen.
Yeah, swollen.
And miserable and tired. Yes, absolutely. You want to pre-plan.
Yes, it's so important. So when do you think it's too late?
That's a good question. I would probably say 2 months, 3 months post-op. What do you think?
I think you can wear a faja to enhance the results that you have anytime after your surgery. I mean, after that first 8 weeks, but in those first 8 weeks is when it's crucial.
Right.
In those first 8 weeks is when you need it there because it's preventing seromas. Like it's so much more than team faja, no faja. Like if you're not wearing a faja and you just had a tummy tuck, you're very likely going to have a seroma or some sort of collection of fluid in your stomach. And you don't want that. If you are having liposuction, you want to be in a faja because those channels are there. That fluid is there. You want those channels to close. You want all of that stuff to pop back.
Absolutely.
So you guys, I've had my surgery in 2017, my first surgery. I had my second surgery in 2019. From 2017 to 2019, I was still wearing my garment anytime I want. Because, I was dressed for work. So anytime I was going to wear anything that I really wanted to enhance my shape, I would wear my faja. And I work in plastic surgery. So most of the days I am enhancing my shape.
Yeah.
So I was wearing my faja all the time. And after I stopped wearing my faja all the time because of COVID, I was like, man, I do miss wearing my faja. I liked it, even
It's
under your clothes.
Usually when I alter a faja for my in-person clients, which I had to pause for a second because I'm getting ready to move. But once they put the altered faja back on, they usually describe it as someone hugging you really tightly. But like that's a beautiful description. Like that's what you can expect. A hug, like a really good, imagine a hot guy with muscles hugging you and holding you real tight. That's what the right faja is going to feel like. And you're going to like that.
You love it.
Yes, absolutely.
I love it. So let me go back to these questions. Okay. For questions about fajas, somebody wrote, please tell us everything.
Hey, we're trying.
We're trying.
Hopefully this episode helped answer a lot of these questions that fall under the category everything.
Okay. Hopefully. This question right here is probably why you are in business, girl. This question.
I'm ready for it.
Can a faja be too tight on your hips and damage your results?
Yes, absolutely. That's why I preach to only order it based on your hip measurement. And when we're talking Amazon, add 2 inches to that number so that we can avoid any type of compression. As long as you size yourself appropriately, you have nothing to worry about. Also, listen to your body. If something feels like it's too tight, it probably is. A good way of checking if your faja is too tight in your hips is if you have it on and you try to raise your knees, like one knee at a time. If you feel like there's a lot of resistance, the faja is too tight. That's like a good little method.
I love that. I love that.
If you can raise your knees up and there's not really any resistance, kind of like wearing some regular gym leggings, that indicates that you got the right size. It's perfect. And the first 3 weeks after having a BBL are the crucial time of avoiding any type of compression for your butt. What you could experience is it quickly going down, but that's probably swelling in a lot of cases.
Fluid.
So
it's a lot of
definitely size. The bottom line is size yourself accurately and you'll have nothing to worry about.
100%. I love that. I think it's very important you keep saying it, and I want you, and I love that you're saying it so many times for women to listen to their bodies. Your body is telling you what it needs, what it wants, what it needs more of, what it needs less of. If you just pay attention, and you get to know yourself so much during your recovery period. And let me tell y'all what I even mean by that. Okay. When I had my first surgery in 2017, I was already a mom. I had already had 2 kids, breastfed, like I'm an adult. But tell me why, after I had my surgery, I started to notice, every time I got my cycle, I put it together after that, once a month, I felt really, really big and bloated and swollen. And I thought it was maybe something I ate, or maybe it was this, or maybe it was that. And it wasn't until I figured out that it was when I was ovulating.
Yes.
Every time I was ovulating, my stomach would just get so bloated, not bloated. It just looked like browned, like a little bigger. Yes. And it wasn't until I figured it out. Oh, it's because I'm ovulating. No wonder. Yes. I thought I got swollen during my period. No, it turns out I'm actually swollen while I'm ovulating, which I never knew. And I was 30 at the time, learning this for the very first time.
Right. Absolutely.
And those are the types of things that we mean by you're getting to know yourself. You're getting to know your body. You think you know, but do we really?
There's so much to learn. Give
me an example of something you learned.
Oof, man. I feel like, how when you're in a job interview and they ask you a random question, I know I have examples, but I can't think of a single one. Let's put a pin in that.
Okay.
And I will think while we continue going through the questions.
Okay. Think about it. Let me look for another question.
Okay, boom.
Here.
I have one.
Okay.
And that's a popular one. And that one we actually touched on the other episode that you invited me to speak on. Creases. Your skin will show a million creases all over and dents and corners and you name it. all of that bounces back and goes away.
All of it.
All of it. And, I was part of, all the plastic surgery forums on Facebook and things like that. Not all of them, there's millions, but some of them. And there's a lot of conversations going around about, oh my God, the creasing, it's going to be permanent, la, la, la. I learned that it's not. And my body taught me that it's not. And that's really it.
It's not permanent. And you guys, okay, the boards online is one of the main reasons why I created this podcast, because I was seeing so much bad information that I was freaking myself out. I was like, oh my God, who is telling these women this? Where did you hear this? And it was online. And it was women who were sharing information with each other, but some of it was really bad information.
Yeah.
Bad information that I'm like, oh Lord, I hope this lady didn't follow this lady's advice.
Yes, absolutely. Unfortunately, when you don't know, you can definitely fall into the trap of following some bad advice.
Correct. And that's why I created this. So you don't have to go look, I'm trying to put together all of the information that's crucial and true and important, so you can wash out the stuff that is not important and it's not, real. Creases.
Not worth worrying about.
Yes. Not worth worrying about. And creases and, those types of little dents during your post-op period, initial post-op period, are one of those myths. Women are so scared. They're so freaked out about this little thing here, this little thing there. And the anxiety is really what's making them, not heal as fast or not heal properly. And it's because they're freaking themselves out over, the way this little tiny line looks, or is my scar going to look this pink forever? Scars go through a process. They'll end up, looking light, but they go through a process too. They'll be red, they'll be pink, and they're going to be pink for a while. That's when you need to protect your scars, you guys. Protect your scars while they're pink with SPF, and don't sunbathe out in the sun to fresh pink scars, because they will turn dark.
Oh, wow. I didn't know that.
Little gem.
Right. Another thing I just remembered I learned also during my recovery, but that was definitely plastic surgery specific, is I was 3 months post-op. I'm not much of a drinker, but at 3 months post-op, we were hanging out with some friends. I had exactly 3 measly little shots. And my legs turned into, I don't even know, what can I compare them to? Columns, elephant legs, whatever is really, really huge and ridiculously crazy looking.
Wow,
my legs were
really?
so huge. And that's why I preach to avoid alcohol. Avoid it like it's the devil for the first 6 months. Avoid it, because you're going to be so massive. And I was wearing my faja, so everything was super snatched, but I could feel it getting really, really tight. But my legs, I didn't have any work done on my legs. My faja is just short legs.
Mm-hmm.
My legs didn't have any compression, so all the swelling went to my legs.
Oh my
and it's
gosh.
Really interesting that happens. I actually want to ask my surgeon about that, because how does alcohol cause that? Such crazy swelling, particularly in post-op patients.
Does that still happen for you?
I haven't drank since then, so I don't know. I really don't know.
Did you stop drinking?
No, I mean, I like I said, I'm not really much of a drinker anyways. I use alcohol more in cooking than anything else. So that one time that I had those 3 shots, that was really it.
Oh my God. You know what?
I was hiding.
You just made me had a realization.
Stop. What happened?
Okay. After my surgery, I was partying, of course. Happy hour here, brunch here, hanging out with my friends and drinking. And before my surgery, I didn't ever really have a problem with swelling in my hands.
Yep. Okay.
And after my surgery, which is actually the reason why I stopped drinking, I don't drink anymore at all, because after my surgery, every time I drank, my hands would get so swollen to the point where I couldn't take my rings off.
Oh, wow.
I wonder what I'm going to do some research.
Me too. Actually, this is going to be an interesting Google search, because when, how they say you're not supposed to smoke after surgery, I researched that, and there's definitely information on that, and an actual medical explanation.
Well, you don't want to smoke after surgery, and I'll tell y'all why. Every time you smoke a cigarette, or any nicotine. It doesn't have to be, it can be a vape. It can be tobacco chew when they chew it, or it can be anything, any type of nicotine, a patch, a mint. I'm not sure exactly how long, but I believe it's for 90 minutes after every cigarette. The surface of your skin receives less
blood,
oxygenated blood.
Yes.
So that less oxygenated blood doesn't help you heal, or you're not getting, healing to that area. For example, if it's a tummy tuck scar, if you're a chain smoker and for 90 minutes after every cigarette, your incision is not getting adequate blood flow or adequate oxygenated blood, then you're going to have some wound complications. And that's why you don't smoke. That's why we tell y'all not to smoke.
Yeah. Same with BBLs. You got that freshly transferred fat that your body is working so hard to build new blood vessels to supply the fat with the nutrients that it needs and make it become part of your body again. It was your stomach before, but now it's your butt. So that's why you don't want to smoke, because exactly that reason. So that's interesting with the 90 minutes. It actually makes a lot of sense. Mm-hmm. But yes, you don't want to smoke prematurely and risk all of your results. Is the smoking really worth it?
Probably not.
No, definitely not. And the question is then also, what about THC? What about marijuana?
So I know that that's the answer for nicotine. For THC, I do not have an answer. I don't know. We wouldn't restrict our patients from smoking THC or that for pain after surgery if they did it without telling us, mm-hmm. If it's helping you heal and whatever, it's fine. Don't tell me about it. You do just don't. I would tell them, just don't smoke a cigarette. Smoke whatever you want. Just don't smoke a cigarette, please. Keep your garment on. Drink water.
Fajate. Okay.
Fajate. Don't smoke a cigarette and drink water. We're good. Anything else you want to do, you're good for me.
Yeah.
Just don't tell me about it. And I don't want to see it on your Instagram.
Same.
Okay, so let's answer this one last question. And then I think we've covered pretty much everything. Anything you think we haven't covered?
We were pretty in depth here.
Okay, this last question, and I want you to go full in on it. Is it difficult to work on faja seams? Because I had to ask 4 local tailors and everyone refused.
Oh, yes. Oh, my God, yes. I have yet see a previously altered faja that was actually done in a way that I like it. I set really high standards for myself to make sure that I deliver to my clients, and I have yet to see anything good. Yes. What I keep hearing is that local tailors, or just any tailor who's, professionally trained on regular clothing, switching over to something that has stretch and has multiple layers of stretch on top of each other, that's a whole different ballgame. So you don't want to just take it to someone who does not have the experience to work with something like that. To top it off, every faja stretches differently. So you can't just go by measurements or something like that. There's a lot of experience and lessons learned that I bring to the table when it comes to faja alterations that you're just not going to get that anywhere else. So it's that aspect. And then, the skill set is one piece, but then it's also having the right tools as well. Because you can't just use a regular sewing machine with regular needles and regular everything else, regular thread for fajas, because there's a different need there. That, it has to stretch. It has to be flat. You don't want the seam to be super thick and sticking into your skin or showing under clothing. You want to also be very smart about where the garment is actually taken in to achieve various desired results. Like if a client wants specifically more lower abdominal compression, that one is one of the most messed up ones that I have seen. So when I get botched fajas delivered, lower abdomen, people really struggle figuring out the logic behind how to do that the right way. I figured out how to do it. There's another thing I've noticed with a lot of fajas. They cut by design, they cut into your breasts. It shows when you have clothes on top of it, because for some reason on each side, your breasts are cut off by a strap. We don't necessarily want people to see that, right? Mm-hmm. We're trying to hide the faja while still getting, the most medical benefit that the faja can give to us. while looking cute and not showing. So I figured out a way to separate those straps. And how did I figure that out? By having that issue in the first place and having that on my body and wanting to dress, but then noticing how, the different structures of fajas just show or impact how it ends up looking with clothes on top of. So there's just so much. There's so many things that really come with experience. And that's why I only do fajas. I'm not interested in altering pants. I don't want to alter dresses. There's plenty of people who are really, really good at that. That's not my cup of tea. My expertise is fajas specifically because I know what my clients need after they had surgery.
Mm-hmm. And it's definitely an aesthetic that an eye that you have to have in order to mold the faja to what they want to look like.
That's such a good point. I can't believe I forgot that. Definitely the eye. So I have my previous side hustle was a lot of like interior design. I was actually, believe it or not, making farm style furniture from scratch. And I was actually really good at it. That's how I paid for my surgery.
How fun.
So I have a really good eye for measuring things. Like I have had multiple clients who came to see me and I would look at their butt or look at their waist and literally guess the measurement accurately or with like maybe 1 inch off.
Wow.
So I have a really good eye. So when I get fajas mailed in, I require very specific pictures to also be uploaded to my intake form, which, by the way, if anyone's interested, you can check it out on www.thefajadoctor.com. My Instagram is @thefajadoctor. So when you fill out the form, I require very specific pictures. I want to see you pulling on the garment because, like I said earlier, every faja stretches differently. So I have to see how it behaves on your body. And guess what? You could have 2 of the exact same fajas, same size, same everything. One of them you wore for 2 months. One of them is brand new. Guess what? Even those are going to stretch differently. So it takes a lot of knowledge and experience that I've been able to accumulate, throughout the course of me having started this business that it's going to show in the end result of the alterations.
Mm-hmm. Exactly. Because you need to have that eye in order to even understand what it is that your client is looking for. So Absolutely. If you take that faja to a seamstress who works on dresses and other stuff, you have to literally break it down and explain, hey, this is the look that I'm looking for. Can you even do this? And does anybody during their post-op period really want to be dealing with anything like that?
Right. It's first of all, it's that. And second of all, a lot of times my clients don't even know what look they're looking for. And it's, to me, look is part of it, but it's even more important that it serves a medical benefit. So I definitely care about the look though, because obviously, right? I want to make sure that my clients just look like goddesses when they wear their faja and feel beautiful.
And feel good.
Because when they like wearing it, their recovery is going to be so much more successful. So my goal is to make sure my clients actually fall in love with their faja. Because now they fit right and they love the attention that they get when they wear them and all these other fun things while getting the compression that they actually really, really need on the inside. Because nobody really thinks about that kind of stuff, right? We want to look good, but there's so much that we need to think about that is going on the inside of our body that needs support as well.
That's right. All of it.
All of it.
All of it. Okay, let's see. I have one last question. Hold on. They just sent me this on Instagram. It says, please, if it's not too late, can you please add my question? How to compress during faja alterations or waiting for your new faja?
So definitely very, very important to stay compressed. I absolutely recommend all day you want to have at least 2 good stage 2 fajas. So a lot of my clients have to ship one at a time. You could also, I don't like this solution, but I am very fast with my turnaround time. You can use a binder or something like that, or your stage 1 with a whole bunch of foams. The binder idea, not a big fan, but anything helps if you absolutely
if you only have one.
Yes.
That's why it's good to always have 2.
Yes.
Wash one, keep one.
Yes.
Mm-hmm.
Yes. And I've seen a lot of things where somebody accidentally burnt their faja and it broke, or like the zipper tears or something. You want to be prepared for those moments. You want to have a backup. I think a really good number of fajas to have, if you really plan on being really serious about your recovery is 3. 1 and 2 need to be your absolute main fajas. They got to be the ones that have some legs attached, some good straps so that you can have, more upper back coverage and everything. And then you can have one either that is specifically to go to the gym in, or that is for special outfits, like a strapless one, or something like that is for special occasions, so that you have that flexibility and no excuse to not wear it. Because every time you don't wear it, you're undoing all the work that your body did.
That's right. That's right. So wear it as much as possible. So before we sign off, let me give y'all the recommendation that we give to our patients in the office. So we want them to be in the garment for a minimum of 8 weeks. After 8 weeks, you can take it off at night to sleep, and you can continue like that for as long as you can, up to 6 months. So if you can wear it, all day, every day until you're 6 months, then you're good. Yep. That's it. Just keep wearing it. You won't cause damage by wearing it for too long, but you could regret not wearing it.
The simplest way of knowing that you should still be wearing it is if you're out of it and you feel yourself swelling up. Not only feel, but also see, as mentioned before.
Correct. You'll feel it. You'll feel
it. Your body will tell you.
That's right. I think the most important takeaway from this episode, you guys, is number 1. Your garment is there to help you. It's not there to hurt you. So use it to your advantage. Wear it for as long as you can. Don't try to get into something too small too soon. How do you know it's too small too soon? It hurts. If it's hurting you to even sit, it's too tight. If you feel like you can't even sit properly, it's too tight. And especially for tummy tucks. Liposuction, it's a little more lenient. But tummy tucks, for sure, do not wear a garment that is too tight, and always check with your doctor. You'll feel as you shrink, as your body shrinks, your garment will start to feel loose. And you need, in order to kind of eliminate the boards and the foams, you need the Faja Doctor to alter your faja to your measurements. Make it more comfortable for you so you continue to wear it. The more you like to wear it, the more comfortable you are in it, the more compliant you will be, and you'll wear it for longer, which is what we want. At the end, we just want you to wear it a little bit, wear a tight compression for about 12 weeks. After that, you're good. I know there's a cult where y'all will wear them forever. I'm part of it. I will wear my faja forever, no matter what. Forever. If anytime I need it, I will put it on. But if you are not part of the cult, if you want to just wear it when you need to wear it, a minimum of 8 weeks, 24/7, and then 12 weeks only during the day. So from 8 to 12 weeks, you can wear it only during the day and take it off at night. And that should be good. You should be good.
Yeah.
Okay. I've been asking this for all of my guests. If you were talking to your best friend and she's thinking about having plastic surgery, what is your one piece of advice for her?
Oh, that's a good one. Find the right surgeon.
I think that is like the number one thing.
That everyone says?
No, that's not the number one thing everybody says, but it's the number one thing that I keep pushing.
Oh, yeah.
You have to find the right surgeon. So yes. Finally.
It starts with the right surgeon. And if you feel super confident in your choice, you have a good vibe going on, you trust the surgeon, it's going to make your experience so much better. So much better. 100%
different than if you're scared and you don't have open communication with your doctor. And who did your surgery? Shout him out.
Dr. Azizi in Chicago. I love him. I'm going to see him tomorrow. I'm so excited. I love him the best. Follow him at Dr. Azizi Chicago on Instagram. All one word, no periods, nothing else. He is truly, truly amazing. 1 year post out tomorrow and he still cares to see me.
That shows you guys. You want your surgeon to follow up with you. You know, they're invested in you. They're invested in your care. That's the type of treatment you get when you go to board certified plastic surgeons who have, these private practices that this is their pride and joy. Their practice is their pride and joy. And when you start going into bigger places where you're kind of lost in the shuffle, who you can only communicate by email, you can't really talk to anybody. That stuff, y'all know how I feel about it.
Scary.
It's scary. Who do you ask these questions to if you don't have, a clear line of communication to somebody in that office that can talk to your surgeon?
Absolutely. My surgeon spent so much time with me before the surgery and actually involved me in the plan for my surgery that when I walked into that OR, I was so hyped up. I thought I was going to be nervous and scared. Not even an ounce of fear. I was so excited. And I really think it's because of the pre-op experience that I had with my surgeon. So that's something that you really want to look for.
You really do. And I think let's end it on that. Your faja is important, but your surgeon is more important.
Number one.
Your surgeon is number one.
That's where it all begins. Everything else trickles down from there.
Absolutely. So you guys, you got to make a good choice. And if you need help finding the right surgeon in the US, contact me. I will help you find the right surgeon. I do not have surgeons outside of the country. Y'all know how I feel. That's all I have to say about that.
Hey, I feel the same way as you. Literally.
All right. I think that's it, you guys. I'll see y'all next week. If you have any more questions, if you think of anything that we didn't touch on, send it to me in a message and I'll touch on it on the next episode. Oh, before we sign off, give them all of your information. How can they find you? Where can they book you? What are your prices? I don't even know this. What are your prices?
So all of that can be found on my Instagram as well as my website. My Instagram is at the Faja Doctor. Doctor is spelled all the way out. And my website is www.thefajadoctor.com. You can find my price list on there. And I have multiple signature alteration services depending on what my clients need. I have a whole bunch of different add-ons. For example, expanding the legs if they're like really, really tight, or tightening the legs if they're too big, shortening the torso if it's overlapping your breast too much or something, or you're just short and you really need a shorter torso, but you can't find it anywhere. Lower abdominal compression, the hourglass to give you that snatched waist look and the big hips. Whatever it is, I am super flexible with every type of request. And, we can talk about it. If you have any questions, please DM me, send me an email, whatever it might be. I answer to everyone.
She's been so great, you guys. You really can't go wrong with the Faja Doctor. I love her. I love how much attention to detail there is in your whole process. I love the leopard bags. I love the colored seams. Like it makes me so excited.
Oh, I really appreciate that. Thank you.
You're welcome. And I think as you continue to grow, I hope to continue to see you grow with everything that you're offering. Everything.
Girl, vice versa, okay? I'm loving your growth as well.
Thank you. I got my sign today. I'm so excited.
Can't wait to see it.
I'm going to show y'all. I can't wait to show y'all. Y'all are going to see it all over. And now it's going to be behind my desk. So you'll see it every day.
I love it. Now I need to see the sign too.
Yes, I'll send you the info.
Yes, please do that.
All right, you guys. I'll see y'all next week.
I would like to end this episode with a huge thank you to all of our listeners. If you enjoyed this podcast, make sure to subscribe to Big Butts No Lies Podcast and follow us on Instagram at Big Butts No Lies Podcast. If you have a topic you want me to cover, please send it to the DMs. If you know anyone on their plastic surgery journey, be sure to recommend them the show. You can also visit us on our website, bigbuttsnolies.com. You'll see the online surgical recovery store. We're adding new items all the time. If there's something you think I need to have on there, send me a DM. Don't forget to leave us a 5-star rating on Apple Podcasts. And don't forget, new episodes every Monday. I'll see you then.